हेलो एवरीवन, आज हम हेल्थ असेसमेंट के MCQ स्टार्ट करेंगे। आज के टॉपिक का नाम है असेसमेंट ऑफ पेरिफेरल वेस्कुलर एंड मस्कुलोस्केलेटल सिस्टम पार्ट 1। क्वेश्चन नंबर 1, ऑल ऑफ द फॉलोइंग आर द पल्सेस विच आर लोकेटेड इन एन आर्म एक्सेप्ट ऑप्शन ए ब्रेकियल पल्स, ऑप्शन बी रेडियल पल्स, ऑप्शन सी अल्नर पल्स, ऑप्शन डी popliteal pulse. Correct answer is option D, popliteal pulse. Question number 2, which of the following pulse is not located in legs? Option A carotid, option B popliteal, option C dorsalis pedis, option D posterior tibialis. Correct answer is option A carotid. Question number 3, when performing an assessment on a client, the nurse notes the presence of an enlarged epitrochlear lymph node. The nurse would anticipate finding which of the following on the assessment? Option A, the forearm and hand for infection or inflammation. Option B, the lower legs for injury. Option C, the equality of radial pulse. Option D, capillary refill and temperature of extremities. Correct answer is option A, the forearm and hand for infection or inflammation. Question number 4, when performing an assessment on a client, the nurse notes the presence of an enlarged superficial inguinal nodes. The nurse would anticipate finding which of the following on the assessment? Option A, the forearm and hand for infection or inflammation. Option B, the lower legs for injury. Option C, the equality of radial pulse. Option D, capillary refill and temperature of extremities. Correct answer is option B, the lower legs for injury. Question number 5, a client has a 1+/0 to 4+ dorsalis pedis pulse on the right. The lower leg is cool, pale and painful. This description is most consistent with option A, venous insufficiency, option B, arterial insufficiency, option C, thrombophlebitis, option D, lymphatic insufficiency. Correct answer is option B, arterial insufficiency. Question number 6, evaluation of the texture, moisture and temperature of the skin, hair distribution, capillary refill and auscultating for bruit are primarily located to which of the following assessment? Option A, lymphatic, option B, respiratory, option C, venous, option D, arterial. Correct answer is option D, arterial. Question number 7, the nurse performs Allen's test to assess which of the following? Option A, patency of radial and ulnar arteries. Option B, arterial circulation to the lower extremities. Option C, varicose vein. Option D, edema. Correct answer is option B, arterial circulation to the lower extremities. Number 8, a client is being evaluated for suspected thrombosis of deep leg vein. Which of the following is the nurse most likely to note during the assessment? Option A, pain in the calf when dorsiflexing the foot. Option B, a cool foot with diminished pulses. Option C, increased pain with elevation of the extremity. Option D, decreased hair distribution on the legs. Correct answer is option A, pain in the calf when dorsiflexing the foot. Question number 9, pain in the calf when dorsiflexing the foot. The test is called which sign? Option A, Trendelenburg sign. Option B, manual compression test. Option C, positive Homan sign. Option D, Fallon's test. Correct answer is option C, positive Homan sign. Question number 10, inspection of a person's right hand reveals a red swollen area. To further assess for infection, you would palpate them. Option A, inguinal node. Option B, cervical node. Option C, axillary node. Option D, epitrochlear node. Correct answer is option D, epitrochlear node. Question number 11, very deep pitting indentation lasts a long time. Leg is very swollen, is considered grade dash edema. Option A, 1+, option B, 2+, option C, 3+, option D, 4+. Correct answer is option D, 4+. Question number 12. When assessing the characteristics of the pulse, the nurse notes which of the following? Select all that apply. Option A, rate. Option B, rhythm. Option C, symmetry. Option D, amplitude. Option E, all of above. Correct answer is option E, all of above. Question number 13. Positive Human sign indicate. Option A, pitting edema. Option B, DVT. Option C, arterial insufficiency. Option D, carpal tunnel syndrome. Correct answer is option B, DVT. Question number 14. Rope-like bulging or contorted vein may indicate. Option A, atrophic vein. Option B, hypertrophic vein. Option C, varicose veins. Option D, none of above. Correct answer is option C, varicose vein. Question number 15. Which of the following factors that increase your risk of developing peripheral artery disease include? Option A, high blood pressure. Option B, smoking and diabetes. Option C, increasing age. Option D, all of above. Correct answer is option D, all of above. Question number 16. Berger's test is used to assess the adequacy of the arterial supply to option A, lower limb. Option B, upper limb. Option C, both A and B. Option D, body trunk. Correct answer is option A, lower limb. Question number 17. The examiner wishes to assess for arterial deficit in the lower extremities. After raising the leg 12 off the table and then having the person sits up and dangle the leg, the color should return in. Option A, 5 seconds or less. Option B, 10 seconds or less. Option C, 15 seconds. Option D, 30 seconds. Correct answer is option B, 10 seconds or less. Question number 18. On inspection of a client's leg, the nurse has found varicose vein. Which test should the nurse next perform to determine the competency of the saphenous vein valves? Option A, Allen test. Option B, Trundle-Berg test. Option C, position change test. Option D, ankle brachial pressure index. Correct answer is option B, Trundle-Berg test. Question number 19. The nurse is reviewing an assessment of a patient's peripheral pulses and notices that the documentation states that the radial pulses are 2+. The nurse recognizes that this reading indicates what type of pulse. Option A, bounding. Option B, normal. Option C, weak. Option D, absent. Correct answer is option B, normal. Question number 20. The nurse is assessing a patient's pedal pulses. What anatomical location should be palpated? Option A, behind the knee. Option B, on the top of the foot. Option C, on the inner spect of the ankle. Option D, on the lateral spect of the ankle. Correct answer is option B, on the top of the foot. Question number 21. For how long does a patient need to make tight clenching fist for modified Allen's test? Option A, 30 seconds. Option B, 20 seconds. Option C, 10 seconds. Option D, 14 seconds. Correct answer is option A, 30 seconds. Question number 22. A nurse performs the Trundle-Berg test for a client with varicose veins. Which action should the nurse take when performing this test? Option A, ensure that the client's legs are over the side of the bed. Option B, tourniquet should be put on before leg elevation. Option C, legs should be elevated for 15 seconds. Option D, have the client stand upright after tourniquet removal. Correct answer is option C, legs should be elevated for 15 seconds. Question number 23. The capillary refill time in a healthy individual adult is normally. Option A, 4 to 5 seconds. Option B, 7 to 11 seconds. Option C, more than 15 seconds. Option D, less than 3 seconds. Correct answer is option D, less than 3 seconds. Question number 24. Ask the person to hold both hands back to back while flexing the wrist 90 degrees. Acute flexion of the wrist for 60 seconds produces numbness and burning in a person in which disease? Option A. Osteoarthritis. Option B. Muscle atrophy. Option C. Carpal tunnel syndrome. Option D. Scoliosis. Correct answer is option C. Carpal tunnel syndrome. Question number 25. There are about how many muscles in an adult human body? Option A 302, option B 206, option C 360, option D 660. Correct answer is option D 660. Question number 26. Back of hands together hold for 60 seconds. Test for carpal tunnel syndrome is called. Option A Daniels test. Option B Fallon's test. Option C Barrettman test. Option D Allen test. Correct answer is option B Fallon's test. Question number 27. How many thoracic vertebrae are there in a human body? Option A 10. Option B 12. Option C 16. Option D 20. Correct answer is option B 12. Question number 28. When the nurse asks a patient to place the right arm behind the head, the nurse is testing for which range of motion? Option A flexion of elbow. Option B internal rotation. Option C external rotation and abduction of shoulder. Option D hyperextension of shoulder. Correct answer is option C external rotation and abduction of shoulder. Question number 29. Fibrous bands running directly from one bone to another that strengthen the joint and help prevent movement in undesirable directions are called. Option A bursa. Option B tendons. Option C cartilage. Option D ligaments. Correct answer is option D ligaments. Question number 30. The functional unit of the musculoskeletal system are. Option A joints. Option B bones. Option C muscles. Option D tendons. Correct answer is option A joints. Question number 31. When reviewing the musculoskeletal system, the nurse recalls that hematopoiesis is take place in the. Option A liver. Option B spleen. Option C kidneys. Option D bone marrow. Correct answer is option D bone marrow. Question number 32. When performing a musculoskeletal assessment, the nurse knows that the correct approach for the examination should be. Option A proximal to distal. Option B distal to proximal. Option C posterior to interior. Option D interior to posterior. Correct answer is option A proximal to distal. 3. Choose a muscle that is not a muscle of mastication. Option A masseter. Option B temporalis. Option C medial pterygoid. Option D orbicularis oculi. Correct answer is option D orbicularis oculi. Question number 34. Choose the muscle that doesn't belong to the quadriceps femoris group of the anterior thigh. Option A rectus femoris. Option B vastus lateralis. Option C vastus medialis. Option D biceps femoris. Correct answer is option D biceps femoris. Question number 35. Skeletal muscles are. Option A unstriated. Option B branched. Option C uninucleated. Option D voluntary muscles. Correct answer is option D voluntary muscles. Thanks for watching. Subscribe for more videos.